Hello again. Welcome back to the Better Together podcast. I'm Mike Baker, and we have another amazing episode for you today. Today, we are talking about this wonderful partnership that we've been able to put together between Heritage Health and Coeur d'Alene Pediatrics. Healthcare is crazy, and just managing a healthcare system today requires a lot of intense work. There's political changes, there's funding changes, there's so many things that happen. And in coming together with the theme of the show, being better together, really means working together between these two organizations. Today, we're going to talk with Dr. Duane Craddock. Dr. Craddock is an incredible physician at the practice at Coeur d'Alene Pediatrics. He's a leader. Families love him. He's amazing. We're going to have a powerful conversation about this new partnership, what it means to the community to have us working together, what it means to the families of Coeur d'Alene Pediatrics currently, and what the future looks like as we build out a better, stronger pediatric service line here in our community. I know you're going to enjoy this show. If you have any questions, drop them in the comments. Or follow up with Coeur d'Alene Pediatrics or anyone here at Heritage Health. We're happy to help. Let's get into it. All right. Well, welcome, Dr. Craddock. Thank you so much for being here today. This is a really exciting episode. As we talked about in the introduction, we're going to talk a little bit about this new partnership that we're working on between Heritage Health and Coeur d'Alene Pediatrics and what that really means for the community. I think we're going to have a great conversation. Thank you for being here. Do you have anything you want to cover before we get started here?
No, thanks for asking me to come and to chat with you. And it's kind of been interesting. It's been a year in the making since we started our first conversations together. And I think we have a lot to share, a lot to be excited about, and a lot to share with the community.
Yeah, it'll be really good. The name of our podcast is Better Together. And as we've been talking through this partnership, that kind of better together themes really come through, as we look at this. Let's jump into kind of the history of Coeur d'Alene Pediatrics for those that might not know about you guys. I mean, you guys have lots of patients, lots of people know you, but let's talk about the history of Coeur d'Alene Pediatrics. How did you end up in Coeur d'Alene, and how did all of this get started?
Yeah, well, it was interesting. Coeur d'Alene Peds got started quite a while ago with Dr. Piston, that then Dr. Neff then took over, and Dr. Neff was a kind of a pillar of the practice for a long time before he practiced, and that's been almost 40 years ago when all this started occurring, and it did start with just a single person practice and just a desire to live in this community, and Dr. Neff grew it over time and added Dr. Shaw, Dr. Rao, and then it just seemed like it just kept growing from there and taking off. And I had the privilege to practice with those doctors, and it was great to kind of hear the historical stories. It's great to hear kind of the humble beginnings where it was pretty quickly that when Dr. Neff came to town that Dr. Piston left, and he was sitting here holding all these patients, and it just was, oh, by the way, I'm leaving. See you later, and have a good day, But then to build it up over time, where we had 3 offices and have been really, I guess, a force in the community for quite some time. I came in 2000, so it's been about 26 years ago. Dr. Martin and I came at the same year. They were busting at the seams and dying to have somebody to come help out. Mm-hmm. And so it was great. We jumped into a full practice, of a full load of patients, and here we are, 26 years later. And it's weird to think about, but it's been a really good ride. We've endured a lot through medicine over that time frame. Medicine's changed quite a bit. We've been able to expand into the 3 offices. We started off in just Coeur d'Alene in the initial days, and then expanded into Post Falls, and then It's been 2008, so just under 18 years I'm in the Hayden location, and to have all those 3 locations. So it's been neat. It's been a ride.
Yeah, no, it's so cool to see, talking about kind of the legacy doctors that, built this communities. So, I mean, our organization, is Lidwin Durney and then a whole bunch of volunteer doctors. And, there's just this kind of immortal group in our community of doctors. I think of Dr. Haller up in Silver Valley. And I mean, all these doctors that just kind of helped raise the community. And, looking at where we're at now versus, where they all were when all of this started. I mean, this community has grown so much. And, when we look at the pediatric practice, I mean, that's something like as parents, I mean, you just rely on your pediatrician. I remember the first time, I saw my first son, Jacob. My wife was having a C-section and she's over here and then he's over here. And I just broke. Like I didn't know what to do. And I had so much worry about, both of them and my heart. I was lost. And I remember the doctor that was helping us at the time, the OB, just like gave me a big hug and he's like, "You're going to be okay." And then the relationship that we built with pediatricians down in Salt Lake and, coming up here, I mean, they have been a big part of our family forever. Tell me about that experience, being on the other side of it as a physician and being able to observe thousands of families and all of the intricacies of that.
Well, even when you bring up the delivery room, it's such a sweet, intimate experience that you have with families. And there's still a number of families I even see today that they remind me of that day. Remember, you were the first one to hold little Johnny, or you're the first one to do this, or stuff like that. And so those are such memorable times in people's lives to be part of. And it's hard because, you are nervous and scared as a parent and don't know what to do. And I always tell stories of myself. And so I still remember our first child, even though I was in training, I was a pediatrician and I was supposed to know what I'm doing, but I still had that moment of leaving the hospital in the car with my wife and my, newly born son of like, oh no, what do I do now? Kind of feeling. And so I think that as long as you continue to remember that, you kind of understand where a new family's at. But really, it's kind of a cool journey. I mean, it really is a cool journey where you start off with this child that is, very vulnerable and has all these needs and very demanding of your time and effort and energy. And then you walk them along this process until young adulthood. It is so rewarding, so fascinating. And all along the way, you're building trust and memories and telling stories and laughing and sharing difficult times. And, not uncommonly, you cry together and you celebrate the little wins, you celebrate the big wins. And it's just, it's a journey. And I always remind parents, it's a marathon, it's not a sprint.
Yeah.
And to walk along this path and then to be fruitful and to raise up these kids for the next generation. And now that I've been doing this for some time, it really is neat to be along the next generation. So a lot of patients I've taken care of from the beginning are now parents themselves. Yeah. And you know the grandparents, you know the parents, and now you know the new kids or the grandkids. And so it's an intimate relationship we have with families that's pretty unique. It's even in today's society, we tend to be a little closed door or just closed off with it. But something about that, taking care of your kids, we ask probing questions, we deal with difficult things, and all of a sudden you're kind of assimilated into part of their family. And what a gift! What a gift to be part of someone's family.
No, I was going to mention that, it's like you're this outside observer, consultant, part of the family role. And I think, such a unique role as a physician, seeing so many families, So we worked with Dr. Odom for a very long time with all of our kids. And I mean, our kids are alive because of Dr. Odom. And, we had lots of long nights and long conversations with Dr. Odom. And just to have her be part of our family, and just to be so grateful for the expertise, the patience, the wisdom. I mean, there's something very special about that, and you hope that that carries through in all of medicine. I think our family practice docs do that, and they have the relationships. I think there is something very unique and special about being on the pediatric side of it and seeing not only the kid but the family interaction and just how all of those things play together and how you can just have this lens on a whole panel of patients. And then in your case, like, you can look into the community and you run into people that multi-generational families that you've experienced. I think that's got to be very rewarding.
Oh, it's wonderfully rewarding. It's why I like the community that we're in, is that you do run into families. I mean, even today was a number of families I've run into that just doing some errands and being part of the community. Family doesn't like it always so much because it means that when we go to Costco, I'm probably going to have 5 or 6 conversations, and we might be there
Exactly.
a lot longer and test their patience level with
Yeah.
it. But to me, that's a great problem to have, and I'll celebrate that. That people actually would like to stop and actually have the conversation. So,
Exactly. Oh, I mean, relationships matter so much. I mean, and I think, when you look at a strong, healthy community, you have a strong healthcare community that's based on relationships and all of us working together. I mean, we need strong hospitals, we need strong specialists, having a pediatric group in town. I mean, it really starts to bring the world together. And I think healthcare, you mentioned healthcare has shifted so much, from when this all started to now. I think relationships have easily been the sacrificial lamb in the healthcare system over the last 20 years. It turned more into business. There's a lot more transaction. I think, we all fight to keep those relationships there. But I think when you look at the healthcare system in general, I think that's the thing that we all miss, is just those awesome relationships with our providers. I think that's critical. How have you guys managed to kind of withstand that over the years, kind of that push? I mean, we have to pay the bills. You have to see patients. I mean, healthcare gets really expensive to run it, and you have to kind of manage that. But what kind of decisions did you guys make as an organization to keep those patients first? Because you guys have such a great reputation for that.
I appreciate the question because I don't think it happens accidentally. I think you have to be intentional about those things, and there are struggles. Those are real struggles, that the intentions we face of trying to work through a day and see the patients we need to see and be able to run a practice and do the volume that's necessary to do that. But I think part of it really is thinking about the patient experience from the very beginning and meeting patients where they're at and realizing that we're all patients. So the same thing, I'd like the same thing of my doctor. I actually saw my doctor today, and I love the time that she sat down and had set aside for me, that we could have even just the casual conversation, but also too then the medical conversation. So I think there's a lot of intentionality of not only meeting families where they're at, what their needs are, and but also to caring about them more than just the medical problem at hand. Things like the nutrition, or is it the where are they doing some sports, and let me tell you more about that. How have they been successful with the play that they're in, and those kinds of things, because they matter, and those things are part of your whole care, not just a medical problem or a problem focused visit. And really, the other thing too, I guess, is relationships matter, like you said, and developing those relationships early on. You need to know more about each other, and it's a two-way street. I share a lot of actually humbling stories of myself, usually things where I've screwed up or messed up over
That's
time.
always the best story anyway.
Well,
Yeah.
because
We're all human.
we're all humans,
Yep.
and nobody's a perfect parent, and nobody's a perfect individual. And I think it helps set the stage appropriately to where, hey, we're all in this together. We support each other. And most of us have been parents as providers. And when you've been a parent, you understand that struggle you have late at night, or that concern you don't know the outcome of this, and you're worried, or you're anxious, or you are trying to provide the best you can. So when you're thinking about, okay, when I'm making a nutritional choice, or I'm working on sleep, or I'm working on whatever else, I'm not doing this just for today. I'm doing this for setting a lifestyle pattern in. So it's 5 years, it's 10 years, 20 years, and eventually it's going to be into the 50 years into your lifetime. And so we're in a unique little window where we get to set good, healthy patterns and uh, um, encourage people to be thoughtful about those things and not just haphazard.
Hmm.
It it's a neat privilege.
Yeah, I mean, it's such an honor working in the healthcare system. I mean, I'm not a physician, but I've, spent 30 plus years working in community health centers and just seeing the amount of life that happens in in the office with patients and just all of the challenges. Like, I think it's so easy to forget that everyone around us is going through the same thing. You're going to honk at somebody because they didn't go through the green, or they didn't go right when the light turned green or something, and you get road rage, and, brah, and it's like, man, that person is probably lost in thought about
Yeah.
their kid, or something that's going on. I mean,
Right.
everybody's fighting a battle, and I think when we started talking about kind of the partnership and what this could look like, there was we felt like such great mission alignment in what we were both trying to do with our organizations in the community. I mean, we want to create organizations that build strong community, and support that healthy lifestyle. Our work with the Center for Healthy Living and really looking at physical fitness and nutrition, and trying to tie that whole experience together. Is just kind of that ongoing commitment to say we know that we can do healthcare better, and as we look at working together between our two organizations, the impact that that can have on, for us being able to have the entire family served, within the organization. And then, with medical and dental and behavioral health and pharmacy and all the other components that we can start to layer in, it starts to become, really exciting when we think about what this partnership can look like, down the road. Before we get into that, because I think that's the fun place to end, we've announced to the community this partnership. We're looking at kind of a early May start date for all of these things to come together. But what do you think the parents of Coeur d'Alene Pediatrics want to know? What questions might they have? Or let's spend a little time sort of giving some people a baseline of what this might look like.
Yeah, absolutely. Absolutely. I'm sure the kind of the question that comes to a lot of their minds is, oh, what's going to change?
Yeah.
Because obviously with merging groups, we're used to that something will change with that. However, I think that what's most important for our families is actually from a patient perspective and point of view, nothing's going to change right off the bat. It's we still have our same clinic locations, we still have our same hours with same providers. We're still providing all the same triage, the care, the refills, the well checks, the behavioral health, the comprehensive care that we've always provided is not going to change. It's and so from their perspective, it's going to look very,
Should look
very
very similar.
similar. Yeah, yeah. And so over time, there's some of those changes that they get implemented, but they'll be slow and methodical. And actually, to your point earlier, was they're going to be advantageous in a lot of ways to hopefully improve some of our access to some of the specialists and some of the difficulties that we've had in the past. By combining forces, it allows us more flexibility in some ways that we haven't had, and actually allows us to even build. We've kind of had the last few years. We've actually kind of been in kind of either static or kind of retraction mode because of the way medicine has changed, and so it's really exciting to kind of actually get back into that mode of, hey, how do we actually improve, expand things for the community, hire some new providers, have a little bit better quicker availability, even with acute care,
Hmm.
some things like that that just I think that families need. And right now, we're not able to fully provide that we would like to. And historically, I mean, I'll pick on something like same day appointments. We used to be phenomenal with getting in the same day appointments, but we have not been able to do that to the degree that we'd like to. But I'm very excited that if we can, get new providers, open the schedules up, that we can actually provide more and more and more of that care in office, as well as we do the wellness visits and the chronic care management and all the other things that we do on a daily basis. So
Yeah, no, it's so exciting for us. I mean, when we were talking about this with the board of directors, I mean, there was a big message there saying, like, we want to learn from Coeur d'Alene Pediatrics. I mean, you guys have such a solid provider base and great reputation. We're really excited to really learn from, all the wisdom that you guys have had as, running healthcare um, in the community alongside us. I think that strength really comes in and I think it helps both of our organizations. We've done some things really well and you guys have done things really well. We've all made mistakes as we go through it.
Of
And
course.
so we're good at that. I think it's been really fun working with the teams because there's a real humble personality with I think everybody that's been involved in this. Like you're going through a business negotiation, there's always stuff going on as you work through that, but it's always been about the end, like how do we take care of patients? How do we strengthen the community and make sure that, pediatrics and primary care are accessible in our community for the long run. And we've talked about expanding, with our rural locations with Kellogg and St. Mary's. I mean, there's all these potential opportunities for us to just get care out, but the goal is to just make it easy.
Right.
If your kid they don't follow a schedule when they get sick. And so we want to make sure just even like on our primary care side and in the pediatric space, just show up and we're going to take care of you. And if there's something we can't,
They do follow a schedule. It's the most inconvenient
exactly
time
the
ever.
most inconvenient time.
Whether it's the evenings or 2 o'clock in the morning or on
Yep.
a Saturday night or a Sunday.
I love
or,
that 3 a.m. fever. You're just like,
the
"Ma."
ear pain.
Yep.
So yeah, and not the pattern you want it to be.
Exactly.
But
Yeah, no, it'll be really exciting. And I think that's our commitment as we worked through this thing together was, I mean, the goal is to make it easier and easier and expand access. And I think that's going to be so cool. Yeah.
it's actually the challenge that when we began the conversation was access was it, with the wage structures changing, it looked like it's actually going to be more
Right.
limited and more restricted and more difficult for numbers of our families. And as a pediatrician, it just does not sit well with us. That's not the way to take care of people. It's not the way to do medical care. And so we've always fought against those things that work against kids. So to being a pediatric advocate, it's it's always been work. Over the last 5 to 10 years, it's been even harder work. But when we're faced with those decisions of, hey, is there going to be really a limited access for a number of our families? We're like, no, we don't want this to happen. We have to find a solution so that all kids, regardless of socioeconomics, regardless of insurance types, regardless, can get care. I mean, we live in the United States of America.
Yeah.
We our kids should be able to get
Should be
care,
pretty
and
easy,
they should
yeah.
get quality care. And there's no reason they can't get quality care and compassionate care. And yet we feel like we're kind of fighting an uphill battle, but that's indeed why a partnership has been a better solution is together we can do things that we could not do independently. And so,
Oh, yeah, it's really exciting. I mean, I think that's one of the fun things about, our providers is we don't spend any time talking about payer mix with our providers. I mean, it's just show up and like patients are going to show up and we're going to take care of them. We're able to, utilize our FQHC status to kind of connect with some different rules. And so for us, like if you're uninsured, show up. If you have Medicaid, show up. If you have Medicare, not a lot of kids on Medicare, but there are some.
there's some.
And commercial insurance is just show up. And if you can't afford your care, we have ways to help you. And when we look at pharmaceuticals, when we look at copays, and we have lots of programs there. Like the financial side of the work within our organization has been created to not add barriers to the system. And I think that part is really fun. I've loved that part of the community health center world. It's just our mission is just to make sure that everybody can get in and we have great care. And so I think that's going to be, another addition, I guess, to, families in the community is just show up. Like, don't put that care off because you're worried about the cost. Like, please come in. We can do so much more when you come in ahead of time and it's early and we can get in front of it. If you delay it, that just makes it so much harder and so much more costly and impactful at the end.
Exactly. Well stated. Well stated. From a clinician point of view, it's funny. I think we'd all rather just be payer agnostic.
Yeah.
Meaning that it doesn't matter. We just want to take care of you, your kids, your family, and do a great job doing it. And that's where our reward is. We love being involved in that and to help families through whatever situation they're going through. Or on the other side of things, that prevention side of things is, hey, how do we help this, you be healthy for a lifetime? Or how do we help nutrition? How do we help exercise? How do we help for healthy habits and establish them early on, even in a technological generation where it's a different battle. How do we help young people understand how to use it wisely and then not control them? Those things like that. So it's a good partnership.
Yeah. Oh, it's going to be so great. So when we think about, I mean, this is the fun part of the interview where we just get a dream. My team always gets worried when I start dreaming because that means more work. But as we look at this, I mean, so when you think of the challenges that are facing families today, when we look at mental health aspects or physical fitness, or I mean, the myriad of things that are facing kids today. If you could wave a magic wand in pediatric space, where would you add some focus or attention? I mean, what are some things we could start to work on to really make life better for people in our community?
That's a great question. That's a really open-ended, can go a lot of different places with that. And maybe this is my own personal bias, but honestly, I'd focus on the family unit.
Uh-huh.
The family unit, I think, has suffered over the last 50s to 70 years. We've become more isolated. We don't have the support necessarily of grandparents or great grandparents speaking into it because we don't have that nuclear family that was once there. We kind of tend to get our sources of information from media, and which is kind of impersonal and sometimes not always the most practical of things. Or we let social aspect things influence us, and not always in great ways. And I think as a culture, I think we struggle with that, and then hence the kids kind of struggle with that. We've had to have, from the economic point of view, often, if there are two-parent family, they're having to work outside the household. If it's a single-parent family, they're still having to work, and they're having to try to manage how do I take care of kids, whether they're younger than school age or even with school, and manage the needs of school with it. And yes, and there's a ever-growing mental health burden that I think is probably tied into what's going on with our culture, what's going on with our families. It's affecting young people in really a pretty significant way. And how do we help them work through that and grow and become independent, functioning adults that can weather the storms that are going to be difficult, and to persevere and to rise above, I think, those challenges that are facing them. And every generation has unique challenges, but I think that's one of the biggest challenges of this generation is to find that value of themselves and find and find ways to show that value. So
Oh, I love that. I mean, I think it really has led to this loneliness epidemic that we're seeing, in kids and adults and, across the spectrum where, I mean, there are millions of ways to stay connected in this virtual space, but so many people still feel so lonely and isolated. And, I I was very fortunate to grow up. I mean, my grandma and grandpa were my best friends. We had sets of grandparents. My wife and I lived with grandma and grandpa for the first little bit when we got married. We saw they were married for 60 plus years. I mean, it was just, that really cool dynamic of having, good parents, grandparents, a neighborhood full of people that cared about us. And I've definitely seen that. We've kind of retreated into our homes and into our own lives a little bit, and I think the way that society is right now, it's so easy to be so divided and polarized, and well, they voted for that person or whatever it is, and you start creating these dynamics where I think when you have that family dynamic and then you're connected through a family to the community, I think some of the best relationships are built on sports teams with the other parents of, the kids on your soccer team.
absolutely.
And it's just that dynamic. I think it's really important. I agree with that. Yeah.
Yeah, I think we were created for fellowship, and when we don't have the right kind of fellowship or interaction with each other, I do think inherently we're going to struggle.
Yeah.
with that and become more
That's
isolated.
good. I think that's going to be a great goal for us. Let's solve that problem in what
Where was that
2 to
magic
3
wand?
years exactly. I think we can handle it. But I think I mean, you guys have done such a great job modeling it. I think that's the only way for us to do it is to model that behavior and be the person that we wish everyone else would be. When we hear stories of providers at Coeur d'Alene Pediatrics in our place, I mean, they're people that just care deeply about the people that we care for. And, I think we can model that. And I love, how you talked about just being human is I've been a dad, I've made my own mistakes, and those are the fun stories to tell. But, for a new parent, it's really helpful to see that, look, you're going to make mistakes. There's no real book here. As much as you want to Google, there's probably a book, but I don't know if it's a good book. There's lots of things that you can go out to, and just to have
The message: you don't have to be.
exactly.
You don't have to be a perfect parent to really have done a good job.
Yep. No, it's going to be really exciting. Well, when we think about, kind of the next year or so, again, we want to reassure all the families within Coeur d'Alene Pediatrics. And then, for us at Heritage Health, we have pediatric patients as well. I mean, for us, we see all of this coming together. I mean, the goal is to just maintain status quo as much as we can, through the next little bit. And then, as opportunities come up, we'll be able to have some really good strategic conversations, but any decision that is made, I mean, that's sort of our commitment to each other is it's always going to be about taking care of the patients, taking care of the community, and building that long-term future for healthcare inside North Idaho. And I think that's so exciting. How's do you have any last words, anything you want to share with?
Yeah, I'm excited because I do think for the patients that have been our patients is we're going to continue providing the high quality, compassionate care. We're going to continue to be innovative. We've always had a real strong spirit of innovation, of problem solving. So obviously, why we're having the conversation today, this is innovative.
Exactly.
I do think that the changes you're going to see are going to actually be helpful. As in access, with hopefully having, not only recruiting, but retaining providers for the future. And just providing, we still provide the good comprehensive care, but then there's some expansion things. There really are some ideas that we've kind of been bouncing off each other, and then we'll continue to kind of say, how do we fit a niche, fill that niche a little bit better? How do we help with resources? How do we support families, from even care coordinations and then holding their hand to kind of, the medical world's wonky.
Yeah.
And it's clunky.
Yep.
And sometimes you do need some hand holding. And I always think about like a family's got a, new child with a new diagnosis of, autism. It is so hard to figure out what to do and how to do it and to go through all the steps. And it's not linear, it's not easy. And so, how do we do that better? If we have more resources, we have more, people who can do that hand holding and guidance or support. I do think since we do have this isolated families and family units, I mean, that maybe now more than even before,
Yeah, you need that helping hand.
that medical home is actually that much more important because sometimes we are the one. I mean, I find that I love doing this, but affirming parents all the time, especially moms, of you're doing a good job.
Yeah.
You can actually pat yourself on the back. They won't do it.
Yeah.
Somebody else has to pat them on the back, but it's still, it's like they need that. So I think expanding that bandwidth to be able to do it for our community, so all of our patients, our community, and in adding new things to it that are strategic and important and helpful. And I would love us to see more and more outreach that, or at least maybe help for those that are in those communities that don't have necessarily the pediatric expertise, that we can support them in a way that maybe they haven't been supported in the past. And so it is exciting to kind of think about those opportunities. And then I guess even too, helping our adult colleagues that have pediatric patients or handing off a healthy young adults or young adults that have been well taken care of to our adult colleagues, and in ways that is very helpful for them to assimilate into the adult world now.
Mm-hmm. Well, that's what I love. It's, reducing silos. I mean, there's always been an easy referral pattern back and forth, between pediatricians and our group. But there's also something very different about everybody under one home, and being able, because the parents of these kids need healthcare, and if the parents aren't healthy, then that makes it really hard to be a good parent, and you're struggling about all the other things. And I know that there are parents in your practice and in our community that have yet to connect with Heritage Health and the breadth of services that are out there. And I think that's the other space that we really can be excited about, is having really a central hub for the care for your entire family. We're committed to really focusing on improving the healthcare for women in this community. There's another big project that we're working on. And you look at, healthcare for the female population and for pediatrics. We have seniors, we've got all this huge group, and there's so many things that we learn as we work together. And then we're supporting that family dynamic across the board. And that maybe if we talk about nutrition to mom, dad, and the kids all at the same time, or in those visits, we have that common theme. Maybe dinner starts to become a gathering place where families get stronger and might be eating a little bit healthier, and you can have those open dynamics. And there's really cool things that happen when you start to tie it together. And that's what I see. I see this incredible future ahead of us where we take the resources that all of our organizations have had and just start to shape them into something that really impacts our community for years to come. It's so exciting. And thank you for trusting us, and thanks for, being a part of this community for so long. I promise you we're going to do our very best to keep things going and support the great work that you guys are doing. We feel very honored to be part of this partnership and watch it grow. And we're just getting started, and it's already so exciting. So
Just getting started, and thank you as well to Heritage Health for even being willing in the very beginning to have the conversation and have the vision to see what this looks like, and to be a very welcoming home to come alongside and work together. We're excited as well.
It's really fun. I know our team has been super excited about Fresh Kicks Friday, so I have to figure out how to jazz up my cowboy boots. I have like one pair of boots that I wear for a year and a half.
You could do polish them every Friday.
Exactly. It's going to be good. But it's been really fun to watch that come together, and we're so grateful for the team at Coeur d'Alene Pediatrics. It's been fun getting to know everybody, and it's going to be great. Well, thank you for being here. I can't wait to have this thing officially kick off. Like we said, this starts first part of May. Letters will go out to patients. And if you're worried about anything, if you have any questions at all, feel free to reach out to the team, at Coeur d'Alene Pediatrics or at Heritage Health. There'll be information on our websites. There'll be information that comes out to you. But at the end of the day, you don't have to do anything different if you're a current patient. Just show up, call the same number, make appointments, come in and be a part of it, and get ready to meet all of these really fun new providers. We've been able to start recruiting and just really get off the ground running. It's going to be exciting. So thanks for being here, and I hope you'll all have a great week. Thanks for being with us this episode, and we'll see you next time.